Welcome to Chapter 2, Part 4, Surface Tension and Effects on Lung Expansion. In addition to the elastic properties of the lung, the fluid, mostly water, that lines the inner surface of an alveoli can profoundly resist lung expansion. To understand just how the liquid coating the intraalveolar surface can affect lung expansion, an understanding of surface tension, the law of Laplace, and how pulmonary surfactant offsets alveolar surface tension is needed. So let's begin by talking about surface tension. Surface tension is molecular cohesive force at a liquid-gas interface. In picture A, you can see cohesion at work with like molecules attracted to like. In picture B, you can see the effect of surface tension. The molecular cohesive force has increased at the liquid-gas interface. The liquid molecules are strongly attracted to the other molecules within the liquid mass. Laplace's law describes how distending pressure of a liquid bubble, not an alveolus, is influenced by 1. Surface tension, and 2. the size of the. For a wonderful video on Laplace's law, please watch this YouTube link that I've included. During the formation of a new bubble at an end of a tube, pictured here, the principles of Laplace's law don't even come into effect until the distending pressure of the liquid sphere goes beyond what is called a critical opening pressure. The critical opening pressure is the high pressure with little volume change that is initially required to overcome the liquid molecular force during the formation of a new bubble. It's very similar to the high pressure first required to blow up a new balloon. Prior to the critical opening pressure, the distending pressure must progressively increase to enlarge the size of the bubble. The distending pressure is directly proportional to the radius of the bubble. Once the critical opening pressure is reached, the distending pressure progressively decreases as the bubble increases in size. The distending pressure, as described by Laplace's law, is inversely proportional to the radius of the bubble. The distending pressure will continue to diminish as the bubble enlarges to its breaking point and then ruptures. It's interesting to know that just before that bubble breaks, the distending pressure is at its lowest level. The fact that surface tension remains the same while the radius of a liquid sphere changes can be illustrated mathematically by rearranging Laplace's law. To demonstrate this concept, consider taking a 400-mile automobile trip. With the formula distance equal to rate times time, d equal to RT, which represents product D and variable quantities RT, we have 400 is equal to R times D. D equals 400 miles, or 400 divided by R is equal to T. On such a trip, assume that we travel at 50 miles per hour and that the trip takes 8 hours. If we travel by train and increase the speed to 100 miles per hour, the time of the trip decreases to 4 hours. If, however, we decrease the speed to 25 miles per hour, the time increases to 16 hours. In other words, as speed increases, the time decreases and vice versa. But the product remains the same. It's still a constant 400 miles, which we need to travel. When two variables are inversely proportional, such as rate and time, the time increases as the rate decreases, and the time decreases as the rate increases. So how do we apply the law of Laplace to the alveolar fluid lining? Because the liquid film that lines the alveolus resembles a bubble or a sphere, according to Laplace's law, when the alveolar fluid is permitted to behave according to its natural tendency, a high transpulmonary pressure must be generated to keep tiny little alveoli open. Fortunately, in a healthy lung, the natural tendency for small alveoli to collapse is offset by pulmonary surfactant. Pulmonary surfactant is an important and complex substance. It's produced and stored in type 2 alveolar cells. It's composed mainly 90% of phospholipids and protein, about 10%. The DPPC molecule has both a hydrophobic, water-insoluble, and a hydrophilic, water-soluble end. This unique property and structure causes DPPC molecule to position itself at the alveolar gas-liquid interface so that the hydrophilic end is toward the liquid and the hydrophobic end is towards the gas. Pulmonary surfactant at the alveolar liquid-gas interface can profoundly lower alveolar surface tension. In the normal lung, the surface tension is low in a small alveolus because the ratio of surfactant to alveolar surface is high. As the alveolus enlarges, the surface tension steadily increases because the ratio of the surfactant to the alveolar surface diminishes. Let's talk a little bit about things that can diminish pulmonary surfactant. As a respiratory therapist, you'll encounter a number of pulmonary diseases that are associated with pulmonary surfactant deficiency. For example, this problem is very common in premature infants who are diagnosed with respiratory distress syndrome, or RDS. These babies are born before their type 2 alveolar cells are mature enough to produce a sufficient amount of pulmonary surfactant. Low levels of pulmonary surfactant increase the surface tension forces in the lungs and in severe cases cause the alveoli to collapse, creating atelectasis. Alveolar collapse can shift the baby's volume pressure curve to the right and decrease the lung's compliance, decreasing the baby's oxygenation level and increasing the baby's work of breathing. The treatment of choice during the early stages of RDS is CPAP, or continuous positive airway pressure. We can also give surfactant, man-made surfactant preparations such as Survanta, Infasurf, and Curosurf. These can often help. In the normal lung, both the surface tension, denoted by A, and the elastic force, denoted progressively increase as the alveolus enlarges. The elastic force is the predominant force in both the small and large alveoli. In the absence of pulmonary surfactant, the surface tension force, denoted by C, predominates in small alveoli. The elastic force, B, still predominates in the large alveoli. Note that as the alveoli enlarges, the pressure required to offset the abnormal surface tension force, C, ultimately decreases to the same pressure required to offset the normal surface tension force, B. So it can be seen that when there is a deficiency of pulmonary surfactant, the surface tension of small alveoli create a high recoil force. If a high pressure is not generated to offset this surface tension, the alveoli. Thank you very much for your time and attention today. This is the end. Have a great rest of your day.